Hi, and welcome to my podcast, the Fertility, Motherhood, and Wellness Show. True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. Thank you for all your views regarding the previous podcasts. It is your encouragement that really motivates me to keep going on. Thank you. Keep your reviews and comments and suggestions coming. For time immemorial and definitely immortalized by our movies, Sheila, or that lady by any other name, had to either faint or have nausea for the entire family to declare, Mubarak ho, bahu maa banne wali hai. In today's podcast, we are going to discuss a problem that's common, physiological, irritating, and when excessive, can be debilitating too for a pregnant woman. Yes, nausea in pregnancy. Nausea of pregnancy is that sick feeling which almost 70 to 80% of the women have during the first 3 months of pregnancy. Ironically, although it's called morning sickness, the nausea may persist throughout the day. Besides the sick feeling, there could also be an abnormal sensation of smell and an aversion to common foodstuffs and even some of the most favorite ones. We don't exactly know why it happens, but it's probably related to the pregnancy hormone, that is human chorionic gonadotropin or beta-HCG. As the levels rise, the nausea may also tend to rise and then plateaus or disappears after the 12th or 16th week. So by 12th, 16th week, you're more or less free of the symptom. The rise of beta-HCG may not be able to explain everything because there are some super women who go through these first 3 months like a breeze without any symptoms whatsoever. Probably there are additional factors like increased estrogen levels, buildup of acid, underlying gastritis, maybe the type of food intake, stress levels of the initial pregnancy days that also modify the severity of nausea. Sometimes an underlying urine infection in pregnancy may manifest as nausea. But all said and done, the iconic image of a woman feeling nauseous and everyone in the family declaring that she's pregnant is an image that is stuck in our minds and movies alike. So there are certain women who have more nausea than the others. So who are these women? Women having multiple pregnancies, that is twins and triplets and more. Some women who have a complication like molar pregnancy. Some women who already have altitude or motion sickness. Such women may have a heightened sense of nausea in pregnancy. If it's your first pregnancy, so usually the nausea is more in the first pregnancy. Or if you've had nausea in the previous pregnancies. So if you've had nausea before, there is quite a likelihood that you'll have nausea in this pregnancy as well. If your body mass index is more than 30, and if for whatever reason you're under stress, so if you're overweight and if you're stressed, your nausea in pregnancy could be more. While all of the above is true, and yes, most women do get nausea, it is important to stress at this point that not having nausea does not mean your pregnancy is not going well. So enjoy the freedom from carrying a sick bag all the time and don't stress about your pregnancy. Remember, stress causes more nausea. Next, let's discuss what are the 10 things you can do to battle this nausea of pregnancy. So 10 things to battle the nausea of pregnancy. Point number 1, keep your mind busy. If you're a working woman, go to work. If you're a homemaker, keep yourself busy. Take up a new hobby maybe. I keep telling patients that if your mind is free, then the chances of you stressing about of whatever things in pregnancy may be more and nausea will be more. If nothing else, go for a walk or a swim. Swimming is anyways the best exercise you can do in pregnancy. Do not, however, overexert yourself as fatigue can also increase nausea. Point number 2, keep a toasted bread or 2 crunchy biscuits by your bedside. Have one of them even before you get out of bed in the morning. Why so? Throughout the night you have built up acid. This crunchy biscuit or the toasted bread will neutralize the acid that you built up over the entire night, and thus your morning nausea might be better. Point number 3. Have small, frequent, non-spicy, non-oily meals throughout the day. I know it's very difficult in this situation to really eat. But if you have small, frequent meals, maybe dry fruits or something else, it just might help you tackle your nausea. Point number 4. Avoid foods and smells that make you sick. Sometimes I know family can be a little overbearing, you should be eating this, you should be eating that, but you just don't feel like eating anything at all. Have your pasta, have your Maggi, have whatever you wish at this point in time. There are only very few foodstuffs that you really need to be avoiding. Beyond that, you can just go ahead as long as you're being able to eat something. Point number 5. Some women are lactose intolerant. The best way to find out is to go off all milk and milk products for a week and see how you feel. I keep stressing this point to pregnant patients. I know, again, family insists you have to drink milk. How can you not drink milk? Milk is required in pregnancy. But to be very honest, they've shown that 75% of today's adults are lactose intolerant. And in these first 3 months, it gets increasingly difficult to tolerate milk. Anyways, the milk that we get right now is really not that wholesome either. So try and go off the milk and milk products. After a week, if you really feel that it hasn't made any difference to you, you can always go back to the milk. But I'm quite sure it's going to make a world of difference. Point number 6. Have less water with your meals and more in between 2 meals. Although food and water are both important, keeping yourself hydrated is most important. And I keep telling patients, even if you're not being able to eat, make sure you're being able to drink enough water. And if you can't hydrate yourself, you are going to be in trouble. Point number 7. Sniff a lemon and keep a piece of ginger in your mouth. Studies have shown that these two really help a hell of a lot. Point number 8. Try acupuncture or acupressure. There is a point called Niguan point. I hope I've pronounced that correctly. You can stimulate this point on your own simply by placing your thumb 2 to 3 finger widths down from your inner wrist between the 2 prominent tendons. I will repeat that once again. It's called Niguan point. You can stimulate this point on your own by placing your thumb 2 to 3 finger widths down from your inner wrist. So you turn your wrist inside, 3 finger width, you'll find a point between the 2 prominent tendons. You can apply acupressure by yourself and you'll find that your nausea is getting better. Point number 9, try slow controlled breathing. Again, if you hyperventilate, if you breathe too fast, your nausea is going to increase. So probably this is one of those meditation techniques that if you focus on your breathing, you try and slow it down, your nausea is going to be lesser. Point number 10, lastly, if nothing helps, speak to your doctor, because there are fantastic approved medicines for this which we can help you. We normally start with B6 supplements and then gradually move up the list to other anti-vertigo and anti-allergics and finally anti-vomiting medications. Please remember 3 things. A. You will not attain nirvana by torturing yourself. So please take medicines if required. B. Listen to and trust your doctor. He knows more than you and cares for you and your baby probably even more than your family member does. So listen to him or her. C. Severe nausea and vomiting of pregnancy, called hyperemesis gravidarum, can be threatening both to the mother and the baby. Do not let it reach that situation. So, when is it that you should press the panic button and speak to your doctor urgently? If you have vomiting to the extent that, number 1, have very dark colored urine or have not had a pee in more than 8 hours, then you speak to your doctor. B. Are unable to keep food or fluids down for 24 hours, then you speak to your doctor. C. You feel severely weak dizzy or faint when standing up, then you speak to your doctor. D. Have tummy or abdominal pain, then you speak to your doctor. E. Have pain or blood when you pee, then you speak to your doctor. And F. Have lost weight, then you speak to your doctor. What do we do? As doctors, we would need to admit you and rehydrate you using intravenous fluids and give you nutrition via the drip as well. The good part is, usually these situations resolve very quickly. So we normally will keep you without any food, give you drips, give you injections to control your vomiting, and then slowly we will put you back on oral medication and oral food. So usually these situations resolve very quickly, and in just a few days you can be home again and enjoy your pregnancy. Sometimes when we break this whole cycle of vomiting in the hospital, the problem doesn't come back even when you get back to the same routine at home. So I hope I've given you enough information on nausea in pregnancy, and don't get scared about it. It's a problem, as I said, which is physiological. Most women will have it. Simple solutions, simple tricks, simple discussions with your doctor can solve most of your problems. This brings me to the end of yet another podcast episode. I hope you enjoyed listening to it as much as I enjoyed making it. If you get a chance to look up my website, www.drrajeevagarwal.co.in, and the associated blog, do go there and take a look. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries, or if you want me to create a podcast on any topic of your choice. This podcast is available on the Apple and Google podcasts, as well as Spotify, and of course a host of other platforms. Do subscribe and leave your comments, suggestions, and hopefully a 5-star rating. Look forward to great interactions. Keep listening.